She spent a lot of money. 20 hours in the dental chair. She walked out with a Hollywood smile, and 3 years later she came to me. 6 teeth had to be removed. Not because she did something wrong, but because no one explained the rules of the game to her. My name is Dr. Dent. I'm a dentist. And in this video, you'll learn what most of my colleagues prefer not to talk about. In this video, we'll go through 5 things. First, what really happens to your tooth when a veneer is placed? Second, why the perfect smile industry hides this from you. Third, what can go wrong and how often it happens. Fourth, are there alternatives that no one tells you about? And fifth, how to make a decision you won't regret. If you're thinking about veneers, don't leave. If you already have veneers, don't leave either. You need to know this. Why everyone wants veneers. Look at any dental clinic advertisement. Identical, white, straight, perfect teeth. That's not nature. That's not orthodontics. That's veneers. The Hollywood smile has become the standard of beauty, not because it's healthy, but because it sells well. Turkey, smile, makeover tourism. Thousands of people fly there every year. Some come back with a dream, some with a lifelong problem. Let's break down why. So, what is a veneer? It's a thin shell made of ceramic or composite. It's bonded to the front surface of the tooth, like a fake nail, but on your tooth. Sounds harmless? Wait. To make it fit perfectly, the tooth is shaved down. About 0.5 to 0.7 millimeters of enamel is removed. Is that little? No. Tooth enamel is about 1 to 2.5 millimeters thick. You're removing up to half of what nature built over years. And here's the key. Enamel does not grow back, ever. This is not a nail. This is irreversible. Every time a dentist places a veneer, it's a lifetime commitment. Your tooth will need coverage forever. Now the question no one asks before the procedure. Veneers are not permanent. They last 10, 15 years. Then they must be replaced. And during replacement, the tooth is shaved again. A little. But again. And again. After 20 years, what's left of the tooth? I'll show you in the 3rd section. But first, let's talk about money. How the perfect smile industry works? The minimum set is 8 teeth. A full smile is 16. That's a lot of money up front. In some countries, 3-4 times cheaper. That's why people travel. But here's what they don't calculate. In 10-15 years, you'll need replacements. The same cost or more, because the tooth is thinner and the work is more complex. Dentists know this. They're not obligated to tell you, but I am. Dental tourism is a huge industry. Hundreds of thousands of people fly to Turkey each year for teeth, from Russia, Germany, the United Kingdom. Prices are lower, clinics look modern, doctors smile. But here's the problem. You undergo an irreversible procedure, and then you leave. If something goes wrong a month later, you can't go back. You go to a local clinic. With someone else's work, no records. And the local dentist says, I don't know what they did. I need to redo everything. Redoing means shaving the tooth again. I'm not saying all foreign clinics are bad. I'm saying understand the risks before you buy the ticket. There's one question almost no one asks. A simple question, but it changes everything. I'll give it to you in 5 minutes. What clinics don't tell you? First thing they'll say, some sensitivity after the procedure is normal. Truth. For some patients, it never goes away. Why? Enamel protects dentin. Dentin has microscopic channels leading to the nerve. Remove enamel, remove protection. If too much is removed, dentin is exposed. Cold, hot, acid, pressure. Signals go straight to the nerve. Coffee becomes painful. This is not rare. Now something more serious. Tooth preparation is stress. Sometimes the nerve becomes inflamed. Slowly, silently, no pain, no symptoms. Months later, the tooth darkens under the veneer. The nerve is dead. You need root canal treatment. That means removing the veneer, treating the tooth, placing a new veneer. More money, more time, more drilling. Statistics. Root canal treatment is needed in 5–10% of cases within the first 10 years. 5 out of 100 patients. No one told you that number, right? Now what happens after 20 years? First veneers, 0.5 millimeters removed. After 10 years, replacement, another 0.3 millimeters. After 20 years, again, another 0.3 millimeters. By 30 years, the tooth is so thin that veneers are no longer possible. You need a crown or an implant. If you did veneers at 30, fine. But if you did them at 20, here's the question I promised. Doctor, what will happen to this tooth in 30 years? If the dentist gives a clear answer, they're honest. If they avoid it, that's a red flag. What they don't tell you at the consultation. Most people don't know there are different types of veneers. The most popular, ceramic, expensive, durable, beautiful. But there's also composite veneers, built directly on the tooth, sometimes without drilling at all. They last 5–7 years, then polished or replaced. Cost 3–4 times cheaper. Main advantage, sometimes reversible. For many patients, this is the right first step. Try the shape, color, feel, without irreversible changes. Were you offered this option? There are also lumineers, ultra-thin veneers, 0.2 millimeters, marketed as no prep. Reality is more complex. No prep only works if teeth are already ideal. If not, drilling is still needed. They're more fragile, slightly bulkier visually. For some patients, perfect solution. Problem: clinics sell what's profitable, not what's best for you. Another key question: what problem are you solving? Yellow teeth, whitening, small gaps, bonding, crowding, braces, or aligners? Veneers don't fix bite, they change appearance. A good dentist starts with the least invasive option. How to make a decision you won't regret. Ask these 5 questions before you agree. Why veneers? Are there less invasive alternatives? How much enamel will you remove? Show me. What happens in 20 years? What's the risk of sensitivity or root canal? What happens when they need replacement? And how much will it cost? If the dentist answers calmly and clearly, they're competent. If they rush or say, "Don't worry," leave. I want to be honest. Veneers are not evil. They're a tool. In the right hands, for the right patient, they work beautifully. When are veneers a good option? Severely discolored teeth that don't respond to whitening. Chips or defects that can't be fixed with bonding. Healthy teeth, no gum disease. You understand it's irreversible. You're ready for the replacement cycle financially. The problem is not the procedure. The problem is how it's sold. You stayed with me this long. You now know more than most people sitting in that chair. Use it. Ask questions. Demand answers. A good dentist isn't afraid of an informed patient. They welcome it, because an informed patient is a satisfied patient, and that's the best advertisement there is.